careful attention to proper bandage application, an awareness of sterile technique, and a commitment to regularly replacing the wound bandage with a fresh one. Though many wound bandages are changed daily, your veterinarian will direct the frequency of change required. Because bandages are applied to many locations on the body, they may appear quite different. The actual makeup of these bandages, however, is often quite similar. They are composed of a primary layer that resides against the wound, a secondary layer that offers padding and provides a reservoir for fluid from the wound to be absorbed, and the tertiary layer provides support, stability, and protection for the bandage and wound. It is this outer portion of the bandage that must conform to the animal's anatomy while maintaining its continuity and protection qualities. The primary layer, that which resides against the wound, is generally made up of sterile gauze pads or specialized wound coverings. These are generally absorbent materials that will draw fluids and infectious debris away from the wound. This primary layer is sometimes wetted with sterile saline, promoting a loosening effect to the debris in the wound. This is called a wet-dry bandage. When the primary...
We also say it's a wet to dry. So if you hear people say, I need a wet to dry on this animal, that's what that is. You start out with the gauze pad around the laceration or the affected area wet, and then you're applying dry cast padding and gauze on top of this to keep it moist, okay?
Layer is dry. It is called a dry bandage. When these absorbent bandages are removed, they tend to pull away the outermost layer forming over the wound. This creates an excellent tool for debriding the debris and dead superficial tissues remaining of the wound. Wounds that are not in need of this debriding process may benefit from a non-adhering primary layer, such as that shown here. Wounds are a commonplace event for many of our pets. You should now have a basic understanding of wounds and their care. Next, we will consider the several types of bandages, splints, and slings used in veterinary medicine and the proper application of each type. These may be applied to cover a wound or to immobilize or protect a part of the body. With all of these appliances, careful attention should be given to maintaining the balance between applying the materials snug enough not to be easily dislodged, yet loose enough not to impair the circulation or any other important anatomical structures. We will look at the following bandages, splints, and slings. Chest and abdominal bandages. Distal limb bandages and splints. A Robert Jones bandage. A modified Thomas splint. An Emer sling. A Velpo sling. And Howells. Let's begin with chest and abdominal bandages. These bandages generally utilize the same 3 layers discussed earlier. Such a bandage is commonly used over a wound or surgical incision located on the chest or abdomen of the animal. Careful attention should be given to not creating too much pressure on the pet's chest, limiting their ability to easily inhale. One should also avoid the excessive use of adhesive products on the hair coat. Using a small amount of adhesive tape along the edge of these bandages will aid in preventing the bandage from slipping, yet will not make the bandage removal process unbearable for the pet. Abdominal bandages are sometimes used with the primary intent of applying abdominal pressure. This is sometimes utilized when internal abdominal bleeding is suspected. This snugly applied bandage should be removed or reapplied every 2 hours. A rolled-up towel is sometimes inserted below the bandage along the ventral abdomen to focus the location for the pressure wrap. Elasticon and vet wrap are 2 examples of bandaging materials that can be used for the tertiary layer that have excellent stretching properties.
Select the best response for this question. Which of the